Welcome back to our channel. Today we're discussing a subject that often goes unnoticed but impacts millions of people worldwide: invisible illnesses. Invisible illnesses are physical, mental, or neurological conditions that you can't see just by looking at someone. Yet these conditions can deeply affect a person's daily life. In the US alone, 10% of the 61 million people living with a physical or mental ailment are dealing with an invisible illness. Despite their prevalence, these illnesses are surrounded by stigma and misunderstanding. People often hear, "But you don't look sick," which only adds to their struggle. So what exactly is an invisible illness? It's any health condition that impacts the way someone lives, but the symptoms aren't visible to others. These illnesses range from chronic pain conditions like fibromyalgia to mental health disorders such as depression and anxiety. Diagnosing these illnesses can be challenging. Many of them don't show up on blood tests or imaging scans, making it difficult for sufferers to get the validation and support they need. This lack of visible evidence often leads to skepticism and bias, even from medical professionals. Who is most affected? Invisible illnesses can affect anyone, but they tend to disproportionately impact women. Conditions like lupus, fibromyalgia, and chronic fatigue syndrome are more commonly diagnosed in women. Unfortunately, women often face biases in medical settings. Studies show that when men and women report the same level of pain, women are frequently perceived to be in less pain. This bias is even more pronounced for people of color. Due to implicit biases and racial disparities, Black individuals and other people of color often receive lower quality care and face increased barriers to accessing treatment for invisible illnesses. Invisible illnesses come in many forms. Neurodiverse conditions like ADHD, autism spectrum disorders, and dyslexia are often overlooked. Mental health disorders, including anxiety, depression, and bipolar disorder, are entirely invisible, but affect 1 in 4 people in the US. Women's health issues, like endometriosis, can also go unnoticed despite causing severe pain. Chronic pain is often misunderstood, especially fibromyalgia, a chronic pain disorder that affects around 4 million people in the US. And then there are conditions like epilepsy, where the illness might not be evident until a seizure occurs. Chronic migraines and headaches are invisible illnesses that can impair a person's ability to function. Even some cancers and autoimmune disorders fall under this category. Common and often invisible autoimmune disorders include celiac disease, type 1 diabetes, and Crohn's disease. These conditions can remain undetected for years, making diagnosis and treatment even more complex. The stigma around invisible illnesses. One of the biggest challenges for those with invisible illnesses is the stigma they face. People often misunderstand or underestimate the severity of these conditions. Chronic pain sufferers might be labeled as exaggerating, while those with chronic fatigue syndrome could be seen as lazy. Christine Miserandino, who lives with lupus, created the spoon theory to explain this struggle. Imagine you have a limited number of spoons to get through your day. Each task, whether it's getting out of bed or making breakfast, uses up a spoon. Those with invisible illnesses start their day with fewer spoons and must be very careful how they use them. How to cope with an invisible illness. Coping with an invisible illness can be tough, but there are strategies that can help. First, it's crucial to be your own advocate. If something doesn't feel right, don't hesitate to speak with a doctor. Keep a detailed record of your symptoms, including their duration and intensity. If you're not satisfied with the care you're receiving, don't be afraid to seek a second opinion, and always keep your medical records organized and accessible. Connecting with others who understand your condition can also be incredibly beneficial. Support groups, whether online or in person, provide a sense of community and shared experience. Finally, consider speaking with a mental health professional. Dealing with a chronic illness can take a toll on your mental well-being, so it's important to care for both your mind and body. Living with an invisible illness can be incredibly challenging, but remember, you're not alone. Understanding, support, and self-compassion can make a world of difference. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel for more content like this. Stay strong and take care of yourselves. Thanks for watching, and we'll see you in the next video.